Hi everybody, I'm Dr. Sham. I'm a rheumatologist from Chennai. So this will be the last video in the series of videos I'll be presenting this month. So this is about osteoporosis. I was talking about October 12th being observed as the World Arthritis Day. So we have October 20, which is being observed as the World Osteoporosis Day. So what happens is osteoporosis is nothing but remember something like how you build what you call a building. You have the iron rods will be there, then you put the cement thing like mix with water and other stones, and you put similar to that. So here also with that cement thing which we put over the iron rods, right? The cement thing along with the stones and other thing, what we call the mortar, that is like something like a mineralization or calcium and other minerals. So whenever that goes off, the bones become weak. So here you can see it's pretty dense. Here you can see it's pretty porous, means they are pretty exposed out. It's like a chalk piece. Easily it's brittle. It can be easily broken. Osteoporosis usually never causes any symptom. The first symptom is going to be a fracture. Remember that. That is the reason it's called as a silent killer disease. So the first symptom is going to be a fracture. So definitely being stooped is not going to help. So it's not just the Eiffel Tower, it's even us. If you are going to be stooped, many times we attribute the stooped posture to age, or elderly person falling in the bathroom and having a hip fracture, we again attribute to age, which is totally not right. If you have a stooped back, or if you have a sudden onset of back pain, or if you see some of any of your elderly people having a height loss, it means they're vertebral. You have a lot of small blocks are there called as vertebra. Some due to osteoporosis, they are undergone what we call fracture. In the spine, fracture means it won't break into two, only the height will come down, what we call a compression fracture. So that is the reason for somebody developing a kyphosis or a high decrease in height, and it's not just attributing to age, is not at all correct. So it's not discussed more, because many times we attribute to age. We tell that my grandfather, mother had a fall, broke a bone, they underwent a hip surgery. Ideally, that's not the way we should see. We should see about preventing, in even for the larger good of the society, because it has a lot of morbidity. So 1 in 3 women or 1 in 5 in men over 50, they will experience osteoporosis fracture. I think if I'm right, it's every 3 seconds or so, one of them will be having a fracture. So there are so many factors. Genetic is there, being very sedentary, not doing exercise, sometimes having diseases like rheumatoid or thyroid, or patients if they are on drugs like steroids or some anti-epileptics. So these are some of the reasons. But in general, if you're going to be active, osteoporosis is generally a disease we see in the elderly age group, but ideally the reason starts in the younger age group. So our peak bone mass usually is seen in our younger age group, like in our 20s, 10 to 30. So if you are going to exercise regularly, take lot of calcium, vitamin D rich products, very unlikely that we will be landing up with osteoporosis later. So if you exercise regularly, go out in the sunlight, take calcium rich products, then later the chances of having osteoporosis or the rate of bone loss is going to be less. And avoid harmful habits like smoking and alcohol. So eat a healthy diet, regular exercise, quit smoking. If too much of alcohol is not good, get enough sleep. These are the 5 ways to prevent osteoporosis. Most important thing is how to identify. So first is risk stratifying. Anybody who is postmenopausal more than 60 years, elderly people, males more than 70 years, if they are on steroids or associated disease, or parents had a fracture, we have a scoring. So we identify those patients and ask them to do something called DEXA scan. DEXA scan is something which will tell what is your bone score, based on which you will treat the patient. So treatment, calcium, vitamin D, the baseline thing. Exercise is important. That is how we have to start. Then we have two types. We have an anti-resorptive, which will prevent excessive bone resorption. Then now we have newer injections where there will be excessive bone formation. So we have both tablets and injection. Depending on the severity, we use that. So healthy lifestyle, exercise, calcium, vitamin D, along with either an anti-resorptive or anabolic that your doctor will decide. Most important thing is always screen the high risk group with a DEXA scan. It is totally preventable. Imagine going for a surgery, getting a hip replacement. Is it better, or just doing a DEXA scan? It's not a very costly investigation in an elderly group, and if it is identified, it's a totally preventable disease. So osteoporosis, please here afterwards don't attribute a what we call a fragility fracture. You walk at that height, you fall. The common areas where you fracture is distal, this wrist fracture, having a hip fracture, or having a spine fracture. So fragility fracture, something with a trivial fall where you are not supposed to break a bone. So if you fracture like that, definitely those people have to be screened for osteoporosis. particularly elderly females more common than males, because postmenopausal they have an increased risk. So it's totally preventable one. So, and treatments are there. So definitely osteoporosis has to be screened regularly and treated. Thank you. Love your bones, and make sure none of us or none of our elderly people are allowed to have a fracture. We identify early and we have to prevent it. That is the idea of this particular video. Thank you.